Welcome again to the Mind Body Temple podcast, your healing space with Dr. Rod.
Hi, Dr. Roth.
Hi, Ali.
I know you have more than 25 years of experience in chronic pain management and chronic disease management. I'd like to hear more about pain, why it's important to talk about pain, and why should we know about pain?
Well, pain is an important factor of human suffering, especially when it becomes chronic. At the same time, pain is a danger signal that helps us to survive on this planet. Something about 25% of the population all around the world are suffering from chronic pain. So it is a major factor in human life, and it's important to talk about it.
You have treated more than 10,000 or 20,000 patients in 25 years. What you have learned, what you have seen, and how your practice has changed in these years.
Yes, of course, when you're a younger physician, you think that you know it all and you know everything about any subject that you're practicing. But over time, you learn more about the human factor of the disease that you're treating. As a physician, I've learned that chronic pain affects every aspect of human life. I call it's humans' unseen enemy. If something happens to you, start bleeding, or you have a broken bone, you'll get more sympathy from people around you because people see what's happening to you. But with chronic pain, people do not see how chronic pain patients are suffering. And, and chronic pain itself covers every aspect of human life. It affects every aspect. You'll have difficulty finding any chronic pain patient that can sleep well or can function well in society or has no problem in the family because every single aspect of the life is affected by chronic pain. So you learn more about the human impact and the impairment that the patients have because of chronic pain. And then it becomes more personal to you because many of these patients I see for many years. I call them my extended family. So it's important for me to be able to help them to have more of a better experience in life because chronic pain over time turns from a sensory signal into something that I call a terrible experience, which is suffering. And suffering is my target as a chronic pain physician now. When I started, my target was to reduce the severity of pain from level 10 to level 8, but now my target is to change the experience of human when exposed to chronic pain, and that's change suffering from more of a learning and growth.
How do you do that?
Uh, by looking at the chronic pain, how it affects a person from all aspects, it's impossible to deal with it only from the pain itself. You have to deal with the whole person. You have to look at how the pain is impacting every aspect of a person's life, and then you have to deal with the whole person. And that's the major problem in our society now. When we go to any specialist, they look at us from that one single aspect. And as physicians, we have in science we have created different classification in order to learn more about the human experience. But in reality, everything happens in this life form, and every aspect of nervous system, psychological system, immune system, hormonal system. We divide them in different classification in order to understand them. But the whole person approach, look at the whole person encompassing all of these different aspects and try to provide solutions that would improve everything related to the person on the personal level, to the family level, and to the society. And, it starts from a point that the patient comes to us with a complaint related to a pain in some part of their body. But when you look at the journey that the patient has been through from the impact of an injury to the development of chronic pain, there are so many factors that are affecting the development of chronic pain. And then treatment of chronic pain needs to look at the whole journey, not just the symptom.
What are those factors?
There are so many historical factors related to the life, from the childhood to the teenagers to the current level of stresses. Every single happening related to our life, from childhood to adulthood, would prepare us for our presentation of life form as we speak.
So it maybe started before the actual pain happened.
Yeah, that's exactly why pain is so personal. If you have the same trauma impacted by 10 different people, you'll have 10 different presentations. And that's the interesting aspect of chronic pain journey because it's a very personal journey. So,
I like the word presentation that you uh, employ to explain pain. Can you elaborate on that, please?
yes, you have something that causes pain, a signal, goes from the area of the injury to the spinal cord and to brain. You have something that causes the injury that turns into a signal. The signal of pain goes to the spinal cord and then goes to the brain. It is with our brain that we perceive our sensations, like the light or touch or pain. These are sensory signals. But before it gets to the top part of the brain, before it gets to the top part of the brain, it passes through the part of the brain that controls our emotions. And the history of our emotional life, the memory of our emotional events through our life, feedback of that goes through the sensation of the pain, comes to the brain. So what we perceive on the brain is the sum of all these signals together. So different people will have different history of life before the injury happens. And then obviously their understanding would be different, their experience would be different, so their presentation would be different. Their clinical picture is going to be different.
Is this sounds as a very complicated, complex ecosystem of thoughts, feelings, emotions, history, education, as I understand. Is it even possible to take everything into account in a medical practice, in a medical visit at the clinic?
That is one of the main problems that we have in today's society, especially in the fast pace of clinical visits. I had the experience of becoming a pain patient myself. Like I've been dealing with chronic pain treatment for the past 25 years. But I had an injury, a couple of injuries, many years ago in around 2003 that, I became a pain patient. So I saw both sides of the table as a pain doctor and as a pain physician. Then I realized that the journey of a pain patient is so lonely and so unique. And because of the fast-paced visits, each doctor wants to deal with you from their own angle of the specialty. And there is no general over-encompassing comprehensive approach related to all aspects of my life or any other patient's life. And that became an inspiration for me to push me towards this journey. I mean, now I'm thanking that injury that caused me to go into this journey of self-development and finding a methodology of helping the whole person, the whole patient's experience, and turning pain from a pain signal, from a danger signal, into a chronic pain, and then using the chronic pain for a journey of self-growth. Because what I believe is that the methodology of helping a pain patient can help them with the chronic pain as is, and then help them with every other aspect of their life as they go through different aspects of the life.
Yeah, wonderful. Can you tell us a little bit more about the chronic pain that happened to you and how you shifted your perspective, or how your perspective shifted during this journey?
Yeah, around 2003, I had a couple of injuries that damaged my left side vision and also left-sided arm ability to move, and then I developed severe chronic pain on the left arm. And I'm left-handed. And at the time I was, and I still am, director of a large medical clinic with numerous physicians and a whole group of patients, thousands of patients that I was responsible for their life and well-being. And, the traditional way of treating the pain, go to the doctor, get treatments, different medication, different injections. But then I realized that this is impacting my performance as a physician. It's clouding my mind, and I really want to be present for my patients to help them. So then I needed to find other ways other than using medication that would slow me down. I could not afford to be slowed down. So then I, sought different ways of treating chronic pain. I looked at the history of human life, looked at different civilizations. How did people over thousands of years dealt with difficult circumstances? And I embarked in a whole journey of self realization, self growth, self development in order to help myself to be able to help others. And then I learned many things, and I realized that there are steps and stages on this whole journey of self-healing that starts with, knowing why you want to get better, and then, making peace with yourself in order to gather your life energy so then you can move forward in order to learn skills that would help you. I realized why different skills that we teach our patients doesn't help them. And, the main reason is that they really don't know why they want to get better. They really don't know what is the goal and purpose of their life. And they always are, fighting inside their spirit about different things that are pulling them in different directions. And then they are gaining resentment about their pain. And the resentment against the pain becomes a resentment against self. And then with that, no concentration about what they want in their life and the internal conflict, they cannot benefit from the skills that they learn. And then once they have gone through these different stages, they become prepared to learn the skills to help them. And then there are so many different new factors that we can teach our patients related to, how to reprocess the pain from a signal that is a sensory signal that has turned into a danger signal and getting back to be a sensory signal instead of a danger signal. It's a practice, it's a process, it's a journey.
Yeah, interesting. It reminds me of the book, It Starts With Why. So treating chronic pain also starts with why. Asking this question does not only apply to business and leadership. So please explain a little bit more how asking this one word, why, affects our treatment, and how important it is to know why we want to get better. And I'm really shocked that people with pain and suffering do not know why they want to get better.
You pointed out a very important point, because for every aspect of our lives, the why is the most important question. And know your why, you can learn your how. When it comes to pain, if you are my patient and you come here when it comes to pain, if you are my patient, you come to me for improvement of your pain, I can ask you, why do you want to get better? Why are you here? You'll tell me that you're here because you want to improve your pain. And I can ask you, why do you want to improve your pain? You will tell me because you want to do things that you love to do and you cannot do now. Then I can ask you, why do you want to do them? And then you can tell, okay, because you want to do things that are important for you. Then I can go, why they are important to you. So layer by layer, I can ask you and you can respond, and I can ask one step further until I get to the core reasons of your life.
So in this theory, if I tell you, I just want to be pain-free, would not be enough?
Well, pain-free is a good answer. Of course, that's why you're here. But then I can go further. Why do you want to be pain-free? Then you want to be pain-free to have a better life experience. But then what do you want to do with that life? Why do you have a terrible experience now, and why do you want to get a better experience? And what do you want to do with that experience? Where do you want to go with that? What do you want to achieve? There's so many questions, layer by layer. We can go further until we get to the core of your existence that we call the authentic core values.
So a person might want to be pain-free to just relax, and that is totally valid. And a person may want to be pain-free to be able to work and make money or do sports.
Yeah, these are all valid reasons. There's
Valid
nothing
reasons.
wrong with these reasons. They're all valid. But they are layers of validity and there are layers of importance.
They need to be clarified.
They need to be clarified and you need to go deeper. Why? Because the deeper you go, the higher will become the energy that you get from clarity about them. Like to get relaxed is something that is motivating, but to be able to do things that you love to do is more motivating for you. To be able to do things that are in accordance with your core values and your authentic core self is another level of clarity that when you find, you get so much energy. Because if I ask you, if you know your core values, know the things that really energize you, really invigorates you.
So this is very interesting. What I'm hearing from you is that we need the motivation to become pain-free, the same as we need motivation to run a business or become successful, at a sport.
Exactly.
Exactly the same thing.
There are fundamental reasons.
Fundamental.
There are reasons why you get up in the morning. You get up, seek something that sometimes we know and sometimes we don't know. There are so many things through life that we become attracted to without knowing why are we attracted to these things. And then once you do this self-realization related to your core values, it becomes clear to you why you were attracted to the things that you got attracted, why you never liked things that you did not like. And what gives you a kick in the morning when you wake up.
Yeah.
And that becomes your motivation. Then I can ask you, okay, you know what you want. Now I have to ask you, how bad do you want that? And then that becomes clear to you that, okay, these are the reasons for me. These are the reasons that I get up in the morning. These are the reasons why I'm active every day. And then based on those reasons, you become energized to do something about everything in your life, including management of your pain.
Amazing. It's like a new paradigm. It's a new perspective. If running a marathon is my goal, then I need a lot of motivation. I need clear goals. I need a clear plan. I need a lot of actions, discipline to reach that goal, even a half marathon. But if I have a chronic pain, let's say back pain, I think I need to find a good doctor. These are fundamentally different approaches.
True. And then the problem with only finding a doctor is that, you can get care from a doctor, but you can't get healing from the doctor. Healing happens inside you. Healing is a phenomena, is a process that happens in your life experience. So the doctor can give you some medication, can give you some guidance, can give you some procedures or do a surgery, but the healing is some level of elevation, some level of change that happens inside you. And why that happens is that life evolves and always try to become better. Now, if you are clear about what you really want in life, then you have a direction. You talked about planning. You can only plan when you want to even go somewhere that you know. So you have to understand the authentic reasons, the core values, the real whys of your life. Why you do the things that you do. Then you can make sense of your long-term, medium-term, and short-term goals. And in order to get to those goals, then you can have planning. You can't have planning without knowing where you want to go. You can't have an address without knowing the destination. But you can go to so many different places in seeking to find what gives you more pleasure, what gives you more temporary satisfaction. And that's the story of our lives, that we go do a lot of things in life that we think like glitter of attraction pulls us different ways. And we spend some life energy, we spend some mental energy, some spiritual energy, some physical energy in different directions in life. And we get to where we are now. We are all product of all of these activities. But imagine if we have clarity about where we want to go, why we want to go, and then realize how learn the skills that you have to learn, plan the path that you have to go to get to that goal. Then you have clarity. Then all your physical, mental, spiritual, emotional energy of all different aspects of your life form comes together and then directs you towards that. And that's the first step. That's the fundamental step. You know, talking about suffering, one thing that I suffer always about is that I don't have enough time to talk to my patients in my physician-patient encounters. That's why I put together the book that I wrote, Mind, Body, Temple, Your Journey for Managing Your Pain and Elevating Your Life. I did that to be a guide for my patients to help them in this journey. And this is all about finding the reason that you want to do. And then the second step, and probably a very fundamental, because when I talk about this, everybody says, oh, I have difficulty about that, making peace with yourself. In this step, you stop the resentment against yourself because you have chronic pain. You develop resentment against the chronic pain and develop some level of resentment ultimately against yourself. And if you are in an internal conflict, you cannot heal.
Yeah, very interesting. You mentioned your book's title, Mind, Body, Temple. It's a very interesting, inspiring title for a book about pain and suffering. What do you mean by Mind, Body, Temple?
Yeah, that's an interesting title. I like this title because, you know, if you look at human civilization, there are so many different places of contemplation. We call them temples or churches or mosques, places that people go to pray or think, or, you know, for Zen, Buddhism, temples are places that people go to. It's like a refuge for people to go to and sense some level of purity, some level of cleanness. And people tend to keep these places clean. But if you look at your life, we think that we own a lot of things in life, like this is my jacket, this is my place, this is my book. But in reality, we don't own anything. The only thing that we own is our mind and our body. Everything else are human-made contracts. They're manufactured contracts that we made. And with the contract, we think that we own something. But the only thing that you own is your mind and your body. Your mind and body is where your life happens. Your life experience happens within your mind and body. So if there's anything, there's only one thing that's really sacred in life. This should be your place of contemplation. This is where your life happens. And this is, I call it your temple. And that is the real sacred.
And I assume what you contemplate is the answer to the fundamental question, why?
Yeah, it's an interesting concept because if you think about it, it's the main thing that you can make change in it. You know, you can make change in your mind, you can make change in your body. And by changing your mind and body, by developing, progressing, improving your mind and body, you can improve your life experience. That's where the healing happens. That's where the journey is. And it's interesting that when you were born, you didn't have a name, you didn't have a nationality, you didn't have a religion, you didn't have an address, but you came to this world healthy and happy. You know, each person's health may be different than others, but you came here without any envy, without any anger, without any history of
suffering. Yeah.
You know, you could cry and laugh very easily. You know, you would never hold a grudge for long. You never hate anything. Hate didn't mean anything to you when you came to this world. But gradually we learn a lot of things that cause the suffering. The biggest part of this whole journey is to unlearn what we have learned. And then that opens the space for the healing. So, you know, as a physician, we talk about the why. Like I've done a lot of contemplation about my own why in life. And I realized that, okay, I was proud when I was younger, oh, I'm a physician, I'm a doctor. Then I realized being a doctor is to have a degree. Like you can go and study and get any degree. If you like it, it's easier. If you don't like it, it's harder. But you can get any degree in life. Um, then, if you're lucky enough to have time to study, you can become a doctor. Many people didn't become a doctor, but they're way smarter than me, just because their circumstances did not allow them to sit down and study. So that can't be so much of a big deal. Then, having a profession, like when I came to Canada, it was difficult to get into my practice. And, that was the biggest goal of my life, to be able to practice. Then I started to practice. Then I realized, if you put the meaning of being a physician, which is the ultimate meaning of life, which is to be at service of others, aside, being a physician is to have a profession. You can have any profession. So being a physician is important because it puts you in a position of serving others. But other than that, it's have a profession. So what is my why? What gives me a kick? What when I wake up in the morning, what excites me? I realize is to become a conduit, become a medium or a way for people to heal, and I assist them in their journey of healing. That gives me a kick. That excites me.
This is your why.
That is my why. So, that gives me energy. So because of that, then I get up in the morning. I try to put my body and mind in order, bring myself in a health and mental zone to be able to help others. So that excites me. You can see I become more animated when I talk about these things.
I can see that, yeah.
Yeah. Okay. So this is something that I found in my life. So I help my patients to start with this step. Find your why. And then I help you to learn your why, how. If you know your why, I can help you to learn the how. But if you don't know your why, you can learn anyhow in the world. You can learn so many skills. And that's why some patients say that I've been doing meditation for 10 years, but I'm still in pain. It doesn't help. It doesn't work. Or I can't quiet my mind. Because you don't know why you want to quiet your mind. Once you know your why, then you can focus on your goals, long-term, medium-term, short-term goal. And the healing happens in this journey, and the journey is really coming back to your true self instead of going anywhere.
Would you say this process, this phenomenon that you call healing, is possible for everyone?
Everyone's story is different, everyone's journey is different, but healing is a part of life. Healing is possible for everyone. The same way that we cut ourselves and we heal, which is, I'm still as a physician amazed with this whole process of healing of a wound. Because that's an example to me that, life is all about amending things and improving things and healing things. And for us as humans, as a life form that we consider ourselves a developed form of this whole cosmic experience, healing is a beautiful part of our life. And we should all be participating in that journey. As a person, as a family, as a society member, as a whole citizens of this whole life experience on this planet.
Well, thank you very much for this insightful and inspiring talk.
Beautiful. Thank you.